Hi, my name is Linda. I am not a medical professional, and the information in this video is for your information only. If you have any worries about your condition, you should consult with your healthcare professional. In this video, I will explore the understanding of arthritis of the feet, its symptoms, diagnosis, and much more. Understanding arthritic feet involves knowing how arthritis impacts the joints, bones, and tissues within the feet. Given the complex structure of the foot, with 26 bones and 33 joints, arthritis can lead to various symptoms and challenges, from mild discomfort to severe mobility limitations. Here is a deep dive into understanding what happens with arthritis in the feet, which occurs when the protective cartilage within foot joints wears down or becomes inflamed, leading to joint pain, swelling, and stiffness. Different types of arthritis can affect the feet, the most common being osteoarthritis, often referred to as wear and tear arthritis. Osteoarthritis is the most common form, especially as we age. Cartilage in the joints deteriorates, leading to pain and reduced movement. Rheumatoid arthritis is an autoimmune disease in which the body's immune system attacks joint linings, causing inflammation. Often affects multiple joints in the feet, and can lead to joint deformities. Psoriatic arthritis is common in people with psoriasis. It causes joint inflammation, and can lead to changes in both skin and nails. It may also affect the toes, causing swelling, redness, and even bone erosion. Gout is arthritis where uric acid crystals accumulate in joints, often affecting the big toe. Gout attacks cause sudden, severe pain, redness, and swelling. The feet are uniquely prone to arthritis for several reasons. Their complex structure, constant use, and weight-bearing function place them under intense strain daily, leading to joint wear, inflammation, and damage over time. Here's a deeper look at the factors that contribute to arthritis in the feet. 1. Constant weight-bearing and pressure. Each foot bears our body weight with every step, whether walking, running, or standing still. The forces generated while walking or running can be several times our body weight, especially when carrying extra loads or navigating uneven surfaces. Over the years, this pressure wears down the cartilage that cushions the foot's joints, making them more susceptible to arthritis. Joint load. Cartilage is essential for absorbing shock and ensuring smooth joint movement. With each step, joints in the feet absorb force to propel the body forward. Over time, this repeated impact can erode cartilage, especially in weight-bearing joints like the ankle and the joints of the toes. Uneven distribution of weight. Certain activities or physical conditions, like flat feet or high arches, can cause uneven weight distribution across foot joints. This increases stress in specific areas, leading to accelerated wear and tear in those joints. 2. High joint complexity in a small area. The foot is an intricate structure of 26 bones and 33 joints, all supporting movement and balance. This complexity provides the flexibility and adaptability needed for various activities, from balancing to climbing stairs. Multiple joints at risk. Each joint has a layer of cartilage that can deteriorate, leading to osteoarthritis, or become inflamed in cases of rheumatoid arthritis or psoriatic arthritis. Given the number of joints in a confined space, arthritis in one joint often affects the neighboring joints, leading to widespread pain and discomfort. Interconnected movement. The foot's joints do not work in isolation, they move together to achieve balance and propulsion. When one joint becomes arthritic, it disrupts the alignment and function of adjacent joints, causing a ripple effect of pain and decreased mobility. 3. Age and wear and tear. Aging is one of the biggest factors contributing to arthritis, particularly osteoarthritis. Cartilage loses its elasticity and resilience as we age, making it more prone to damage. In addition, older individuals may have had decades of foot strain from sports, work, or daily life, all of which contribute to joint deterioration. Degeneration of cartilage. Over time, cartilage thins and becomes less capable of withstanding friction and stress. Constant use and pressure compound this process in the feet, accelerating cartilage breakdown. Reduced joint lubrication. Synovial fluid, which lubricates joints, decreases with age. Reduced lubrication in the foot's joints causes more friction, worsens joint wear and contributes to stiffness and pain. 4. Foot shape and alignment issues. Not everyone's feet are shaped or aligned the same way, and certain shapes or abnormalities can predispose a person to arthritis. Common alignment issues that increase arthritis risk include flat feet, fallen arches, high arches, and bunions. Flat feet, fallen arches. Individuals that may have flat feet can cause the ankles to turn inward, placing stress on the inner side of the foot and ankle. This uneven load can lead to faster cartilage wear in those areas, increasing the likelihood of arthritis. High arches. Individuals with high arches often place extra stress on the balls of the feet and the heel, leading to arthritis in the midfoot or heel. Bunions and toe deformities. Structural deformities like bunions, an enlargement of the big toe joint, create abnormal joint alignment, leading to uneven joint stress and eventually arthritis in the big toe. 5. Susceptibility to injury and trauma. Foot injuries, such as fractures, sprains, or ligament tears, can increase the risk of developing arthritis, particularly post-traumatic arthritis. Even minor injuries can affect the alignment and function of the foot, leading to joint damage over time. Post-traumatic arthritis. An injury can alter the joint surface, leading to premature cartilage wear. Injuries that damage ligaments, tendons, or bones can also disrupt normal joint function, accelerating arthritic changes. Repetitive strain. People engaged in repetitive foot movements, such as runners, dancers, or those who stand for long periods, are at a higher risk for arthritis due to microinjuries that gradually deteriorate joint cartilage. 6. Inflammatory conditions and autoimmune responses. Autoimmune forms of arthritis, such as rheumatoid arthritis and psoriatic arthritis, are particularly damaging to the feet because they cause inflammation in joint linings, leading to pain, swelling, and joint destruction over time. Unlike osteoarthritis, which is caused by mechanical wear and tear, these inflammatory types stem from an immune system malfunction. Rheumatoid arthritis. Early in the disease process, rheumatoid arthritis frequently affects the feet, causing symmetrical joint inflammation, e.g. both feet. The immune system attacks the joint linings, leading to swelling, pain, and eventually deformities, such as claw toes or bunions. Psoriatic arthritis. Psoriatic arthritis often affects the toes and can cause sausage toes, where the toes swell and become red. This condition can damage both joints and surrounding tissues, leading to a breakdown of joint structure over time. Gout. While not autoimmune, gout is arthritis characterized by uric acid crystal buildup, commonly in the big toe joint. Gout attacks are painful and recurrent, and the resulting joint damage can lead to chronic arthritis if left untreated. 7. Lifestyle factors and overuse. Certain lifestyle factors, like high-impact sports, wearing unsupportive footwear, or carrying excess weight, can exacerbate arthritis risk in the feet. High-impact sports and activities like running, jumping, or sports that involve sudden direction changes put extreme pressure on foot joints, leading to quicker wear and tear. Inappropriate footwear, shoes lacking support, or high heels can misalign the foot and place pressure on certain joints, making arthritis more likely. Tight shoes can particularly compress the toes, leading to joint inflammation. Obesity. Extra weight increases the load on the feet, accelerating joint wear. Even a small increase in body weight can disproportionately increase foot joint stress. Making a complete look at the symptoms of arthritis in the feet can help people understand the early signs, allowing for timely treatment and potentially slowing the progression. Here are the main symptoms to focus on. 1. Pain and tenderness. Early stage. Pain in the feet, particularly around the joints, can be a common early symptom. It might feel like a dull ache after physical activity, or a sharp pain during movement. Progression: as arthritis advances, pain can become more intense, even during rest. Tenderness is when touching or putting pressure on the joints, such as when walking or standing. 2. Stiffness. Morning stiffness. Many people with arthritis experience stiffness in the feet, especially in the morning or after periods of inactivity. This stiffness may improve after some movement, but can worsen as arthritis progresses. Difficulty with flexibility. Reduced range of motion, such as difficulty bending toes or flexing the foot, can make walking or fitting into certain types of shoes difficult. 3. Swelling and inflammation. Swollen joints, particularly in the ankles and toes, are often a sign of arthritis. This may result from inflammation due to the breakdown of joint cartilage, which leads to fluid buildup around the joint. Persistent swelling can also lead to noticeable warmth and redness around the affected areas. 4. Joint deformities. As arthritis progresses, it can cause changes in the shape of the joints, particularly in the toes. Bunions, hammertoes, and other deformities may develop, leading to additional pain and discomfort. This can also impact balance and gait, making walking increasingly challenging. 5. Grinding or popping sensations. Sometimes, individuals may feel or hear a grinding, grating, or popping sound when moving their foot. This is caused by the bones rubbing together due to the loss of cartilage, which usually cushions the joints. 6. Bone spurs. Arthritis, especially osteoarthritis, can lead to bone spurs, small bony projections, in the affected joints, particularly around the toes or heel. These can cause pain and discomfort, especially if they press against nerves or other bones. 7. Difficulty walking or standing. Persistent pain, stiffness, and swelling can make everyday activities like walking, standing for extended periods, or going up and down stairs difficult. People with arthritis in their feet may adjust their posture or gait to reduce pain, which can lead to issues in other parts of the body, such as the knees, hips, and lower back. 8. Fatigue. Constant pain and discomfort can lead to fatigue, which may not directly impact the feet, but affects overall energy levels, making it more difficult to stay active or complete daily tasks. 9. Numbness and tingling, rare but possible. In rare cases, arthritis can cause nerve irritation, leading to sensations of numbness, tingling, or even burning in the feet. This can happen if bone spurs or joint swelling put pressure on nearby nerves. Each region of the foot can experience arthritis differently. Here is a breakdown of common sites affected by arthritis. Structural changes happen gradually, especially with types like osteoarthritis. However, these changes can make a noticeable difference in foot shape and movement over time. Toe deformities. Arthritis can lead to visible changes in toe alignment, especially in the big toe, which may bend or angle outward, a condition often mistaken for bunions. Rheumatoid arthritis may cause multiple toes to develop deformities, resulting in claw or hammer toes. These deformities make wearing standard shoes challenging, leading to pressure points and worsening pain. Bone spurs and nodules. Bone spurs are extra growths of bone tissue that develop when the body tries to repair joint damage, commonly seen in osteoarthritis. These can form around the joints and may feel like hard lumps under the skin. Nodules are especially common in rheumatoid arthritis and can form on the tops of the toes, the sides of the feet, or near the heel. Though not always painful, they can press against shoes or surrounding tissues, causing discomfort. Bony growths or joint fusions. In some cases, severe arthritis can cause the bones to fuse, eliminating joint movement altogether. This often occurs in advanced cases of arthritis and can lead to significant functional limitations. Ankle joint. Arthritis in the ankle can make it difficult to point the foot, move up and down, or even walk without discomfort. The ankle's role in maintaining balance and absorbing impact makes arthritis here particularly limiting. Big toe. Osteoarthritis and gout often affect the big toe. Arthritis in the big toe joint limits the toe's range of motion, making walking or wearing certain shoes painful. Midfoot. Arch area arthritis in the midfoot can cause pain in the arch, and even lead to a flattening of the arch over time. This region is essential for shock absorption, and arthritis can lead to foot issues. Hindfoot. Heel area arthritis in the hindfoot affects the subtalar and talonavicular joints, impacting side-to-side foot movement. This can make navigating uneven surfaces or hills challenging. If you develop long-term arthritis in the feet, it can cause many problems, such as 1. Chronic arthritis can lead to permanent deformities like bunions and hammertoes, making it hard to find comfortable footwear. 2. The progressive pain and stiffness limit daily activities, impacting overall health, muscle strength, and flexibility. 3. The gait of the foot can change, altering walking patterns that can strain other joints, leading to issues in the knees, hips, and back. 4. The persistent chronic pain in the foot can increase sensitivity and contribute to mental health challenges like anxiety and depression. 5. You are at a higher risk of falling, as arthritis affects balance, increasing the risk of falls, particularly in older adults, potentially leading to further injuries. 6. Limited mobility and pain can restrict hobbies and social interactions, impacting mental well-being. 7. Secondary health conditions. Reduced activity levels raise risks of obesity, heart disease, and diabetes, along with muscle loss and osteoporosis. 8. Joint changes can pressure nerves, causing numbness and poor circulation, complicating foot care. 9. Severe arthritis may require aids like canes or wheelchairs, impacting independence and mental health. 10. Is emotional impact. Chronic pain and reduced mobility can lead to frustration, loneliness, and anxiety over maintaining independence. Arthritis in the feet has widespread effects, emphasizing the importance of proactive management for physical and mental health. Diagnosing arthritis in the feet involves a combination of clinical examination, imaging studies, and sometimes lab tests, to determine the type and severity of arthritis accurately. Here is an overview of how healthcare providers diagnose foot arthritis. When you are first diagnosed with foot arthritis, you may have a clinical examination. The doctor will assess the location, intensity, and duration of pain, noting if it worsens with movement or pressure. 2. Imaging tests. You will take an X-ray showing joint space narrowing, bone spurs, and deformities. MRI will provide detailed images of cartilage, tendons, and ligaments, which are useful for detecting early arthritis signs. Ultrasound helps visualize soft tissue inflammation and tendon damage, often associated with rheumatoid arthritis or gout. A CT scan can also be used when detailed bone imaging is necessary, especially in cases of complex joint structures. 3. Laboratory tests. Blood tests may measure rheumatoid factor, anticyclic citrullinated peptide antibodies, and uric acid levels to identify types of arthritis, including gout. 4. Additional diagnostic methods. This includes a bone scan, which can detect less visible inflammation or infection by highlighting areas of bone repair or inflammation. Dual energy CT. For gout, this helps identify urate crystals specific to gout, especially in deeper joint spaces. An accurate diagnosis is essential for developing an effective treatment plan and addressing specific joint needs. There are many strategies for living with arthritic feet. Managing arthritis in your feet involves self-care, lifestyle changes, and creating a supportive environment. Here are some practical strategies. 1. Daily foot care. Wash feet daily, dry well and moisturize to prevent dryness. Inspect for sores. Check for redness, sores, or pressure points. Toenail care. Keep nails trimmed or seek help if needed. 2. Footwear choices. Supportive shoes. Choose shoes with arch support, cushioning, and a roomy toe box. Ladies, avoid high heels. Go for low heels or flat shoes for better weight distribution. Custom orthotics. Consider custom insoles for added support and alignment. 3. Foot-friendly environment. Anti-fatigue mats. Use mats in areas where you stand for long periods. Non-slip surfaces. Place non-slip mats in slippery areas for stability. Accessible footwear. Keep frequently worn shoes in an easy-to-reach spot. 4. Pain management. Hot and cold therapy. Use warm baths for stiffness and cold packs for swelling. Massage and stretching. Gentle massage and stretches ease pain and stiffness. Elevation. Elevate feet when seated to reduce swelling. 5. Adapted physical activity. Low-impact exercise. Activities like swimming or cycling reduce foot strain. Stretch regularly. Perform stretches to keep joints flexible. Pace yourself. Rest as needed and avoid activities that cause intense pain. 6. Emotional well-being. Relaxation techniques. Practice deep breathing or meditation to manage stress. Support groups. Connect with others who have arthritis for support and advice. Seek professional help. Counseling can provide strategies for coping with chronic pain. 7. Flare-up plan. When you have a flare-up, you should rest and avoid activities that strain your feet. Prepare pain relievers. Keep cold packs and topical creams on hand. Wear cushioned shoes. Switch to supportive footwear for extra comfort. 8. Medical support. Regular podiatrist visits. Routine check-ins help manage arthritis progression. Communicate with your doctor. Share any changes in symptoms for treatment adjustments. Stay informed. Learn about new treatments to discuss with your provider. 9. Use assistive devices, walking aids. Canes or walkers reduce pressure on your feet and improve stability. Easy-use shoes. Slip-on shoes and shoe horns make dressing easier. Handrails and ramps. These additions around the home improve safety and ease movement. These strategies can help you manage arthritic feet more comfortably and maintain a better quality of life. 9 tips for managing foot arthritis involve combining supportive footwear, exercises, and pain relief techniques to improve mobility and reduce discomfort. 1. Supportive footwear. Choose shoes with arch support and cushioning. This reduces joint strain and absorbs impact. Roomy toe box. This prevents pressure on the toes, easing arthritis pain. Avoid high heels. Low or flat shoes distribute weight more evenly. Consider rockasole shoes. This reduces strain during walking, which is especially helpful for arthritis in the toes. 2. Custom orthotics. Reduce joint pressure. Custom orthotics provide personalized support and align the foot. Enhance stability, improves balance and reduces pain while walking. Over-the-counter insoles. High-quality insoles can still provide support if custom options aren't available. 3. Hot and cold therapy. Use cold for swelling. Apply ice packs to reduce inflammation, but always cover the ice pack with a towel. Never put the ice pack on the skin. Heat for stiffness. Use warm packs to relieve stiffness before activity. Contrast therapy. Alternate hot and cold treatments to improve circulation. 4. Pain management. Topical pain relievers. Creams and gels target painful areas. Over-the-counter pain medications. Always consult with your doctor. Massage therapy and acupuncture. Gentle massage and acupuncture may help alleviate pain. 5. Low-impact activities. Water exercises and cycling reduce joint strain while maintaining fitness. Yoga and stretching improve flexibility and balance. Soft surface walking. Walking on grass or cushioned tracks reduces impact on feet. 6. Manage body weight. Reduce joint pressure. A healthy weight eases arthritis symptoms. Anti-inflammatory diet. Foods rich in omega-3s and antioxidants can help with inflammation. It will help if you go on an anti-inflammatory diet, such as fruit and vegetables, oily fish and poultry, keeping red meat to a minimum, and alcohol and sweet foods. Stay till the end of this video. and I shall show you foods that can help with inflammation. 7. Assistive devices. Canes and walkers provide stability and reduce the load on feet. Braces and splints support specific joints and reduce strain. Compression socks improve circulation and reduce swelling. 8. Rest and recovery. Elevate feet. Reduces swelling after activity. Schedule rest periods. Alternate activity with rest to prevent flare-ups. Pace activities. Avoid overexertion to reduce pain and stiffness. 9. Professional guidance. Avoid cancelling appointments, such as podiatrist visits. Regular checkups help adjust treatments as needed. Physical therapy helps maintain joint flexibility and strengthen muscles. Occupational therapy provides tips for adapting daily tasks to reduce foot strain. Combining these approaches allows you to manage arthritis symptoms, stay active, and improve your quality of life. Effectively managing foot arthritis can significantly improve comfort and quality of life. Here's how. 1. Live proactively. Balance rest and activity, wear supportive footwear, and choose low-impact exercises. Recognize activities that cause discomfort and adjust to prevent flare-ups. 2. Seek professional support. Regular checkups with healthcare providers help tailor your care plan. Physical therapists can guide exercises, and occupational therapists offer tips for daily adjustments to reduce foot strain. 3. Maintain mobility and independence. Focus on exercises for flexibility and muscle strengthening and consider assistive devices when needed. Small changes, like non-slip mats and pacing activities, support safe, active living. 4. Build emotional resilience. Chronic pain can affect mental health, so practice mindfulness, connect with support groups, and prioritize self-care. 5. Adopt a holistic approach. Combine medical treatments, lifestyle changes, and self-care to address physical and emotional needs, empowering you to live fully with arthritis. 6. Look forward with optimism. Arthritis may pose challenges, but proactive choices, like supportive footwear and daily stretches, are positive investments in well-being, allowing you to lead a fulfilling life despite arthritis. Thanks for listening to my video. If you have any worries about your condition, consult your healthcare professional. If you found this video helpful, please click the subscribe button to follow my channel and press the bell. Please comment below if you have any questions, and I will get back to you. I hope this video has helped. And good luck.